Understanding your total body iron stores is actually trickier than you think. That's because most of the iron in your body, while it is circulating in your blood, most of it is circulating inside the red blood cells. When we try to estimate your total body iron stores, we send 4 tests. And we use other clues like findings on the CBC and, of course, the clinical history to try to figure out what's going on with an individual patient's iron status. Iron saturation or transferrin saturation is a calculated value, and it's based on 2 numbers. The first is your serum iron level. Serum iron level is actually one of the least reliable markers of your total body iron stores because it fluctuates throughout the day. It has diurnal variation, and it's influenced by what you've eaten recently and how long you've been fasting. Serum iron is also suppressed in states of inflammation as a protective mechanism. Having a low serum iron level actually does not mean that you're iron deficient. The other measured value that we use to calculate a transferrin saturation is the total iron binding capacity, or TIBC. The way this test is run is we take a sample of the patient's blood, we throw a measured amount of iron into that blood, and then what will happen is that any available transferrin molecules that are not already bound to iron will bind that iron. Then the lab is going to take out any remaining iron and calculate the difference. And the number that's left is the total iron binding capacity. So think of it like the number of available open slots to bind iron. So in low iron states and iron deficiency, your TIBC will be high. You have a lot of available open slots to bind that iron. We calculate the transferrin saturation by measuring the serum iron, measuring the TIBC, and then you divide the serum iron by TIBC and you're left with a percentage. If that percentage transferrin saturation is less than 20%, that suggests iron deficiency. Ferritin is the most specific marker for iron deficiency. So if ferritin is low, if ferritin is less than 20, or in some cases less than 30, depending on, again, the specific clinical circumstances of the patient, that is also consistent with iron deficiency. The tricky thing about ferritin is that it is an acute phase reactant. So like serum iron, when you're in a state of inflammation, that ferritin number is going to be less accurate. It's going to go up. And so in cases of severe inflammation, ferritin can be quite elevated, and it is therefore not sensitive to rule out iron deficiency. So in patients that have chronic or acute inflammation, iron studies can be much trickier to interpret. And in those cases, the clinical history, the CBC findings, those are going to weigh a little bit more into my interpretation of that patient's iron status. Hope that helps. Follow for more information about blood.